My name is Joe Peroni, and this is the Rise Above Project. And today I want to explore ideas on how to prevent PTSD in children. And these ideas will also work for adults. Now I want to go through about 3 different phases during this show. So the first one, I want to look at some major research that was done by a Dr. Richard Miser Stedman. That's the first part. But I also want to challenge him on some of his real interesting thoughts that he has on social support and self-blame as how it pertains to PTSD. And in the third part of the show, I want to offer you a personal story. And what I want to do is I have about a 7-question PTSD template. And it's a good way to be able to predict if somebody's going to have PTSD. So I want to use this template on the story that I tell you. And so it can give everybody an idea, and it could put all the ideas of the show together on how somebody may have PTSD or how they may not get PTSD. So with that, let's start right from the beginning. So the new research on preventing PTSD done by Dr. Richard Miser Stedman, he has 2 major conclusions. Number 1, he said that the pressure to process the trauma might actually be counterproductive. But of course, he says you want to allow the child or the adult, if it's an adult, to talk about the trauma in the way that they can and when they're able to. Now, I find that to be very interesting because it seems like in most type of trauma therapies these days, there's this real push that you can't resolve trauma unless you directly talk about it. But there's also plenty of evidence out there that says that you can re-traumatize people by doing that. So it's not totally necessary to make people talk about each and every detail of their trauma. And they may not even actually remember all of that trauma. So that's number 1. Number 2, he says in order to support recovery, we have to normalize the stress responses. Now, we talked about this a little bit last week. And again, I 100% agree with this. His example would be if you're talking to a child, you can obviously allow them the space to be able to have emotions and allow them to be able to speak about it. And you can validate it. You can say, of course you feel scared. Of course you feel nervous or stressed. However, you're safe now. And that's the big part of it, because part of the symptomology of PTSD is where people get stuck. And it's hard for them to move forward, and it's hard for them to be present. So what he's saying here is that it's perfectly fine to have all of these symptoms that may line up with PTSD. But we have to really make sure that we let a child know that they are in a safe environment. Now, of course, if we're talking about complex post-traumatic stress and their environment is the problem, this won't work. But this typically, obviously, will work with a one event type of thing. So in order to have this conversation, we really need to talk about what's called acute stress disorder. And this can be diagnosed from 3 days up to a month after a traumatic event. So I think about 5 years ago in Las Vegas, there was the shooting. And there was a lot of, you would see this in social media or in the newspapers here in Las Vegas. It's like overnight, everybody has post-traumatic stress disorder in Las Vegas. I could see why they said it, but technically that is not true. What is true is that 3 days later, the appropriate people can be diagnosed with acute stress disorder. Now, if it lasts over a month, that's when they can be diagnosed with PTSD. And it's very interesting, like, why would that be? And the answer is great. It's because a person who goes through a traumatic event and they are naturally and normally going through the stress response after the traumatic event, they have the same exact symptoms, or most of the same exact symptoms, as a person with PTSD. There's really no difference. The only difference becomes length of time. And because it becomes chronic rather than acute, that's where we can diagnose as PTSD. So the point is that it's normal to have these symptoms after a traumatic event. It's just after a month, if a person is stuck, that's when we have to look at it a little bit more and deal with that. So the point is always to move through. Now, something that I found very interesting, I am not a religious person. I find myself to be more spiritual. However, I have read Psalm 23, and I hope this doesn't trigger anybody if you're not religious. Again, because I'm not super religious myself. But I'm going to take one part of this, because I really do think it talks to PTSD in a sense. And it says, though I walk through the valley of the shadow of death. And obviously there's more to it. But I like this for a couple of reasons, because it says, I walk through the valley. It doesn't say I stay there. It doesn't say I get a sleeping bag and a pillow and hang out there. It doesn't say I victimize myself by sitting in it. It literally says you walk through the valley. And that really is how we should handle acute stress disorder before it becomes PTSD. The other part that I find very interesting here, it says, through the valley of the shadow of death. In other words, it's not death. It's the shadow of it. And that's also a part of PTSD, where people keep reliving and having flashbacks and they believe that they're in danger. And again, let's take the Las Vegas shooting. So where it happened, they were in danger. A day later when they were at home, or a month later when they were at home, they're probably not in danger, but they feel like they are. Again, it's the shadow of death. It's not real. So this is where we can help them in terms of treatment. Now, we're talking about the symptoms of acute stress disorder and PTSD. So let's just lay it out there of what those symptoms are, because again, we want to normalize them. So we're looking at hypervigilance, we're looking at avoidance, we're looking at flashbacks, we're looking at obviously negative moods, anxiety, depression, things like this. And we're looking at sleep disturbances. That becomes very difficult for people. It also could be disturbances in their eating. So these are some of the basics. However, what would be the risk factors for moving from acute stress disorder to PTSD? Again, we need to look at that because, again, everybody goes through traumatic events, but not everybody gets PTSD. So within that realm of acute stress disorder, we need to be able to do something to prevent people from getting PTSD. So we need to look at some risk factors. In no particular order, we're looking at low self-esteem. We're looking at a history of trauma, history of mood disorders, and of course the severity of the event. Maybe the person has a very negative outlook on life in general, or a negative outlook on themselves. Using avoidance as a coping mechanism can also obviously lead people to get PTSD. And unfortunately, one of the risk factors for PTSD is being a female. Now, I could do a whole show on why that may be or not be, because there's a lot of controversy in that area. So just for today, I think I'll just leave it alone, because I don't want to get too far away from the message for today. But let's just go with the thought that most evidence does indicate highly that being a woman in our society is a risk factor for PTSD. So here's a question. Which people are most likely to suffer long-term from having an adverse event or an activating event or a traumatic experience? Typically, it's going to be a person who believes that something is wrong with them. That's number one. Number two, people who believe that there's something wrong with other people. And number three, people who believe that the world is a dangerous place and it needs to be avoided. So again, this is more cognitive that we're talking about here. These are not the normalized stress responses that Dr. Richard Meiser-Stetten was talking about. This is deeper and it's a little bit harder to deal with. Now, the interesting part of his study that I'd like to challenge a little bit is that the doctor said that there's no correlation between self-blame and an increase in PTSD. There is evidence, though, that says that he's wrong. And I want to take a look at that too. The interesting part here is, and I think it gets a little confusing in the literature, is that there's different kinds of self-blame. So we can look at the two different kinds. The first one, characterological self-blame, which would mean that a person thinks that there's something wrong with them and nothing can be changed. So if a bad thing happens, they take full blame and they say, well, that's the type of person I am. I deserve that and I can't do anything about it. And if they believe that, of course, that's going to increase their PTSD because they're taking full blame for something that is not their fault, and they believe that it's unchangeable. However, on the other side, we have self-blame, where somebody can blame themselves from a behavioral standpoint, meaning that they did something wrong. Maybe that there was something that they did that contributed to that situation. And in that sense, they have some power and control because they can change that behavior. And so if they know that and they have control, and they could say, well, next time this won't happen because I will act in a different way. In that sense, it's going to lower their chances of having PTSD. Now, the doctor who did this study, I think he did a really great job. However, I don't think that he parsed out the difference between behavioral and characterological self-blame. So I think that's where the discrepancy is. He also says something very interesting about social support. He said that social support does not decrease the chances of somebody having PTSD. Now, of course, there's plenty of evidence that says that he's wrong. Why would that be? Why would there be evidence on one side that says that social support doesn't help, and on the other side it says that social support actually helps? Well, of course, it seems so natural to think that if you're supported socially, whether it's society, whether it's your family and friends, why wouldn't that be helpful to you? And here's the difference where I think the doctor did not parse out all the material. It's for this reason. Going back to the risk factors of PTSD, if you have low self-esteem, you're going to have a lot of difficulty being able to accept the love that's given to you. If you have social support, but you repel it, social support won't help. It's like pouring water into a glass that's upside down. I don't care if you pour a drop or if you pour 10 gallons. If the other glass is upside down, it's not going to capture any of the water. Thus, it doesn't matter how much social support you give a person who generally thinks that there's something wrong with them, who doesn't like themselves, and is absolutely unwilling to take anything positive from another person. So that's where that discrepancy is going to be, and he doesn't account for that in his study, and that's a little bit unfortunate, because I think saying that social support doesn't help people go through PTSD is really not accurate, but that's just my opinion. So what I want to do is I want to tell you a story, and then I'm going to go through the questions of my PTSD template, and we'll see why or why not I may have had PTSD or why I didn't. So let's start it off like this. This week I've been watching the Jeffrey Dahmer special on Netflix. And it's this whole other thing. We don't have to talk about that. But the thing that really reminded me of something in it was there was a hitchhiking scene. I think it was the first episode or the second episode. And it reminded me of something. Notice I didn't say the word triggered, because I'm not triggered. It just reminded me of something that happened to me like 40 years ago. And so I'm going to tell you the story as best as I can. It's about 40 years ago, like I said. So I used to train at this gym. And I was probably at the time 16 years old, maybe 17. But either way, I was very young and I didn't have a driver's license. And I probably weighed all of 140 pounds, although I was a good athlete. So I would go to the bus stop, wait, and then take this bus all the way to a particular town. From there, I would walk a couple of miles to the gym, and then I would reverse the process to come back home. Well, on this particular day, I was on my way home, so I had already walked a couple of miles, and I got to the bus stop, and it was pouring rain. And as you might think, it takes, I don't know, 12, 15 minutes to walk, so I was already walking for 30 minutes. Now I'm sitting at the bus stop, and it was pouring rain. I was soaked through, I had my gym bag, I was wearing a t-shirt, and this guy pulls up to the bus stop, and he had a pickup truck. I looked inside, he got my attention, and he says, "Just getting back from the gym?" And I said, "Yeah." And I looked at him, he looked like, a masculine guy with a pickup truck, certainly a lot bigger than me. And so I felt safe. So I was like, sure, we're going in this direction. So I jump in. It wasn't long before he had something else in mind. So he puts his hand on my thigh, and then I start to push to the door, and he starts asking me, if I was interested in whatever, sexual favors. Now my heart was beating out of my chest. I was scared to death. I'm looking at this guy and I'm thinking, I don't know what I'm going to do here. Like, I'm stuck. I'm in this guy's car. He's bigger than me. He's probably stronger than me. And at the time, I assumed he was from the gym. That's how he recognized me. Looking back on it, I was a dumb kid because, sure, I'm sitting there in a tight, soaked through t-shirt with a gym bag. I think it was a pretty good guess. I was coming from the gym, so he just kind of said it. But, he probably wasn't from the gym. I don't know. But anyway, so he was trying to sexually assault me. Let's just get down to brass tacks. So of course I was trying to push him away, and my heart was really beating. So he said, "Listen, let me make this easier for you." And he takes out a bunch of money. And he's like, "I'll pay you for it. It's not a big deal. I don't want to hurt you." And I'm thinking, yeah, but you want to. So I was scared. And I said, "Listen, I can't do that. I'm not going to do that. I'm not blah, blah, blah." So we're sitting at a red light, and as soon as the car stopped, or the truck, I should say, I opened up the door real quick, jumped out, and I ran the opposite way, so he couldn't follow me real quick if he wanted to. And as I was running this way, I stopped, and I noticed that he came back. So then I went back the other way, which would be me going home, and he never turned back around again. And so I ran, it was like 2 or 3 miles home. So that's basically the story. Now, by today's standards, you could say that's a sexual assault. What else would you say? Attempted assault, attempted rape, kidnapping. I don't know, you can name it all. But by today's standards, you would say that that's an extremely traumatic experience for a young kid, and it could affect me for the rest of my life. That's possible. But let's go through the template. Because I can tell you, I hadn't thought about it in 40 years until I saw this TV show with the hitchhiker, and I thought, I did that once, and I got caught. So that didn't work out well. But I never thought of it as a trauma. I did then. So let's just go over the questions. So, number 1, did I need to talk about the incident? No, I don't even think I know I didn't tell my mother, and I know I didn't tell my father. I didn't talk to anybody about it. I don't think. Now, I was with my friend Chris, and we used to hang out. We used to listen to Who records. There's the Who again, by the way. And we would talk. And I said, "Oh, by the way, guess what happened to me the other week? Blah, blah, blah." And I told him a story. He said, "Wow, you must have been really scared." And that's about it. I think that's the only time that I remember ever talking about it. And it was kind of in passing, and that was it. So did I need to talk about it in detail every second? No, absolutely not. That's number 1. Did I normalize the stress response? Yeah, I didn't guilt myself into thinking that I was scared, because I was scared. I remember my heart was really racing. Now, somebody could say, well, why would you guilt yourself into having a stress response? Well, I'll tell you why. Because I was a good wrestler, I was a good boxer, I was a good football player, and I worked out. So why would I be afraid of another man? Like, it would almost be like I just punch him in the face and be done with it. But that's not true. When you're in a situation like that, when you feel extremely vulnerable, and back then it was also very different. I don't mean to sound homophobic, because I'm not. I'm like the most liberal guy on the face of the planet. But we're talking here 1981, 82. And back then, talking about somebody being gay was very much shamed. Like, you couldn't even talk about it then. So the fact that there was a guy groping me and touching me and wanting to pay me for sex was like a taboo subject that you wouldn't talk about because it would somehow implicate you. So I wouldn't even want to admit to having a stress response and being scared, because everybody's thought then was gay people are these very feminine men. And I'm like, feminine man? This guy was like twice my size, and he's driving a pickup truck. So that didn't fly. So again, did I normalize the stress response? I actually did. Yeah. Number 3, did I use avoidance as a coping skill? No, absolutely not. I worked out the very next day, and I walked in the same place I did before. I took the same bus at the same time, and I just went business as usual. So I didn't avoid anything. Why? Because I cared about working out. I love working out. One random individual wasn't going to stop me from doing something that I loved. So again, that's how you handle acute stress disorder and moving it through so you don't get PTSD, is to keep it in motion. And this is how you deal with emotions as well, by the way, because the term emotion has motion, move. So I'm a firm believer, 30 or 40 years ahead of my time, because people are talking about this somatic experiencing now, which is, I totally believe in it. And they're saying, oh, by the way, in order to work out these stress responses, you should work out, you should move, you should go for a walk. No kidding. So after that happened, I jumped out of a car, I ran home a few miles. So there's no doubt in my mind that was helping part of my positive response to the situation, let's say. Number 4, did I believe that something was wrong with me? Characterologically, no. There was nothing wrong with me. I made a mistake. That's for sure. I shouldn't have done that. How many times did my parents tell me never hitchhike? The first time I do it, I get in trouble. So no, was there something wrong with me? No. So I didn't think that. Did I believe that there's something wrong with other people? Now here's where it gets interesting. Did I think there was something wrong with him? Yeah, because what he did was illegal and it was absolutely wrong. And it was, it's terrifying. It's not something that you do to a person. That's what a bad person does. However, interestingly, I also had a level of compassion for him, because as a masculine guy in a world that says that gay people are not allowed to love who they want, I thought, how weird to go through a life that he had to literally see if he could pick up a guy off the street that he doesn't know, that nobody could talk about him, and literally pay him for sex. So there was a part of me that felt bad that our society was like that he couldn't just have a boyfriend and walk down the street hand in hand. Now, maybe it wasn't that, right? Maybe he was a little more towards the, he wanted to hurt somebody, that type of thing. But I didn't really think about that. So overall, no, I didn't think that there's something wrong with all people. I didn't immediately say something's wrong with all gay people. Like, that would be ridiculous. In that particular situation, that individual did a wrong thing. That's what I thought. Did I think that the world was a dangerous place? The world is a dangerous place, but there's also many good things. And in terms of percentage, I don't think you could try to minimize your life to try to maximize your safety and security. I think that that's worse. So is there dangerous things? Of course there is. Do I walk across the street without looking? No. I look on both sides and I walk across the street. You know, that's what I do. Do I work out every day? Is that dangerous? Sure. There's danger in lifting a few hundred pounds over your head. Of course there is. But you just do things, so you don't let it take over your life. Again, that's why it didn't lead to any PTSD symptoms. Number 6 on the list, self-blame. Let's talk about characterological self-blame. Did I think that I was a bad person? No, not at all. Had nothing to do with me being a bad human being. I was just a cold, soaking wet guy that had already walked a couple of miles and already had a 2-hour workout at the gym, and I was tired. And somebody offered me a ride home that looked like a fellow gym member, so I thought I was safe, and I wasn't. It was a lack of judgment on my part, and it was a mistake. But am I a mistake? No. And self-blame, behaviorally. Did I make a mistake? Do I believe that I did something wrong? Yes. I don't think hitchhiking, or if you want to say like just getting a ride from a stranger, is a smart thing to do. I knew it wasn't a smart thing to do, but I did it anyway for the reasons I already mentioned. And I'm also in control because I knew that I had the choice not to do that again. Now, this is a part that might trigger people, and I don't mean to, so I'm talking about myself, nobody else. There's a lot of thoughts out there, especially in therapy, when you're talking about trauma therapy, is to never blame the victim. In this sense, I'm the victim. Did I blame myself? I just admitted it. I partially blamed myself. Now, in a good world, in a heaven-like world, in a nirvana type world, you should be able to jump in a car with somebody and they say, oh, it's amazing that at your age you're trying to work out every day, and let me just give you a ride home. And everybody loves everybody, and everybody just, and then maybe we stop off and, he buys me dinner and whatever it is. No, that's not the way the world works. I had something to do with me being in that bad situation. So am I blaming myself? Yes, because I'm partially to blame. If I didn't get in that car willingly, nothing would have happened. So now I know, again, let me say it again because I don't want to hurt anybody here, but there's this thought that 100% of the time, never blame a victim. And I agree with that when it comes to certain things. But in my particular situation, if I'm looking at it from my point of view is that I'm in control of that situation. Now, if I was on the side of the street and he overpowered me and he threw me in his pickup truck, that's different. Then I wouldn't have blamed myself. I would have said that he's a perpetrator that just overpowered me and I couldn't do anything about it. But in this situation, I contributed to my own problem. And because of that, it gave me power because I had the power not to make that same stupid mistake again. And I did not. So I hope this show offered some value to you about exploring some ideas on how to prevent PTSD. There's more to it, and I'm sure I'll do that in other shows, but I don't want to make this show too long. So we're going to go with that for today. So hopefully that was valuable. My name is Joe Peroni. This is the Rise Above Project. Please subscribe and tell a friend. Thank you.